Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Benign Prostatic Hyperplasia, or hypertrophy. It's known as BPH. It's an enlargement of the prostate gland, and it's a common condition as men get older. In fact, it affects 50% of men over the age of 50, and as you age, as you get older, you're even more likely to have BPH. An enlarged prostate gland can cause uncomfortable urinary symptoms, frequency, straining, weak stream, and BPH, or an enlarged prostate, can also increase the risk for bladder, urinary tract, and kidney problems.
Does
not a good thing.
No.
You women get off easy when it comes to this problem.
That's exactly what I was thinking. Previously, treatment for BPH usually involved one of three options: watchful waiting and behavioral changes, drug therapy, or surgery or laser treatment. But now a new option, steam treatment, has shown great promise, and it's changing the way doctors treat BPH. Here to discuss is Mayo Clinic urologist Dr. Tobias Kohler. Welcome to the program, Dr. Kohler. It's nice to meet you.
Thank you so much for having me.
Great to have you on the program. And we're all looking forward to, especially the men in the audience, looking forward to hearing about this new treatment for BPH because it is so common. Before we do that, tell us a little bit about the prostate gland. Where is it? What does it do? Why is it a problem?
Well, the prostate gland keeps guys like me in business. That's pretty much the bottom line.
So far, yeah.
It's it doesn't really have that much of a purpose other than to contribute a little bit of a fluid to the ejaculate. But it just tends to cause problems. It's situated between the bladder and the urethra, and I like to describe it to patients as a donut. And so that donut is the prostate, and you pee through the donut hole. So all those treatments you mentioned, with the exception of watchful waiting, seeks to basically increase the size of that donut hole or relax the pressure around the donut hole so men can urinate better.
But you said it really doesn't do that much, but we couldn't reproduce without it, right?
Well, technically, when you ejaculate, some of the seminal fluid, some of the contributions from the prostate are helpful, but not necessary. So you could extract sperm and do a whole procedure and get somebody pregnant that way, but you couldn't have sex the old-fashioned way and get somebody pregnant without your prostate. You're right.
It's sort of the grease, the lubrication that helps the sperm get up to the egg. Is that it?
In a way, yes.
Well, explain it better.
Well, it contributes energy to the sperm.
Oh,
it's
there
like
you go.
Nutrition.
Energizes the
It
sperm.
energizes, and it helps control the pH to make the otherwise harsh conditions that the sperm would encounter more survivable.
Why does a normally healthy prostate all of a sudden start to develop these BPH type symptoms?
It's in the genetic destiny. Mm-hmm. So as we get older, the prostate gets bigger. And if you look at the decade of life, that's the prevalence of enlargement. So if you're an 80-year-old, you have an 80% chance of having an enlarged prostate. If you're 100 years old, you're pretty much 100% chance of an enlarged prostate. And then half of those men who have enlargement will actually have symptoms that bother them that we have to do something about.
But isn't it interesting that it gets larger as we get older and when we don't really need it? I mean,
Right.
You'd think it would shrink, wouldn't you? I mean, wouldn't that be ideal?
No,
Not for a urologist.
What are some of the? Let's go through the pros and cons of both of the treatments, the three treatments options that we mentioned.
Okay. Well, so let's start with the most conservative, which is active surveillance. Okay. So we used to think, at least, that if men have problems urinating, we don't really need to do anything about it unless it's causing symptoms, unless it's bothering you enough. Some guys get up twice in the middle of the night and they're happy with it. Other guys are miserable getting up twice. So basically, typically we act if the men are bothered, and that's a signal that we need to do something. Now, there are some hard and fast signs where we absolutely have to intervene, like recurrent infections or inability to empty your bladder, or bleeding or damage to the kidneys, etc. But for the most part, the guys that I see, they come in because they're bothered by their symptom.
Before we finish on that watchful waiting, is there anything an individual can do to make it better?
Well,
behaviorally,
yes,
lifestyle?
Yes. A lot of the complaints that we have in regard to urination have to do with urgency, frequency, and then getting up in the middle of the night. So lifestyle changes can drastically affect that. So we do know that, first of all, being a healthy weight and having a slimmer waistline is better for the prostate. You tend to have less problems. Also, what you drink and what you eat makes a big difference in your symptoms. So if you drink a lot of caffeine, you can expect to get up more often. If you drink alcohol before you go to bed, you can expect to have to get up in the middle of the night. So the easiest lifestyle changes if you're having problems getting up in the middle of the night, are drink less before you go to bed, a couple hours. Elevate your legs before you go to bed so you can get all that extra fluid that's accumulated underneath your socks in your bladder before you actually, are lying down. And then avoid alcohol or other kind of fluids that were going to make you urinate more often.
What is the drawback to drug therapy?
Well, there's a couple. First of all, it's cost, and this is a pill that you have to take every day. And then there are pretty much side effects. So few things in life are free. So when you take these medications that relax the prostate, sometimes you end up with ejaculatory dysfunction so that when men orgasm, they don't see fluid come out. Other times you have problems with dizziness when you stand too quickly, etc. As a matter of fact, like airline pilots, they can't take this medication because of its potential side effects. So, but most of the time it's inconvenience and cost and some of the sexual side effects with pills that
All right, we know there are lots of surgical options. There's lots of different ways to treat this surgically, but you've got a new way, steam treatment. Tell us about that.
Yeah, so remember that the prostate, the donut, as you will, is surrounded by nerves that make erections possible, and then at either end of the donut are sphincters, the valves that control your ability to start and stop urination. So whenever you operate on the prostate and try to make that hole bigger, historically we would have to use some kind of a heat source that could, the heat would go too far and affect those nerves that affect erections, or the heat could injure the valve, which stops and starts the stream. So a risk of most procedures that surgically target the prostate is erectile dysfunction and or incontinence.
Right.
And then the last one would be ejaculatory dysfunctions, because when men ejaculate, the valve at the bladder end has to snap shut or be closed. But when you cut out a lot of extra tissue, sometimes that doesn't work anymore. So then the semen goes backwards into the bladder. And so that bothers some men.
All right. But how is steam treatment better?
So the difference with this is that the steam treatment actually uses a convective heat source instead of conductive heat. So that means that the nerves that are outside the prostate never get heated up because the heat is targeted within the steam ball that this treatment produces. So we put a little tiny needle in the office. We hit a button, 9 seconds, the machine goes ping, and then you form a 2 centimeter steam ball in the prostate. Everything that steam ball touches essentially dies, and that's a good thing because after a few months, there's going to be a giant crater there, and you're going to be able to urinate a lot better because now you've made the donut hole a lot bigger. At the same time, you don't affect either valve on the front end or the back end, so you don't get retrograde ejaculation, you don't get problems with incontinence, and also you don't affect erections.
Outpatient procedure?
Yeah, so you can either do it in the office, takes about 5 to 10 minutes, the actual procedure part, or you can do it as like an outpatient same-day surgery, depending on the size of the prostate, that kind of thing.
And is it covered by insurance?
Absolutely is covered by insurance.
Wow.
Complications?
Of course, with anything, bad things can happen, but the reason why so many men select this one as opposed to others, there's less problems with bleeding. There's no problems with erections. There's much less problems with ejaculation. You always are still at risk of getting infections afterward. Sometimes urination is going to be temporarily made worse because what we do is we irritate the area by putting the device in and by going through the whole rigmarole there. But other than that, it's pretty minimal side effects.
And I'm sorry, go ahead.
Success rate?
Success rate, very good, very high. So this treatment is relatively new, so we don't have good long-term data. But so far, 3 years out, greater than 90 to 95% of men are doing excellent, which is as good as you can do.
Do you expect then that this will take drug therapy and surgery away and you'll just use the steam treatment?
Well, for me personally, I used to do the laser surgery, green light laser, and this has essentially replaced this practice so far. In terms of medications, I think it will because, first of all, there's 2 points to address. Number one, not everybody wants to take medications, but they would settle for them because there was no risk of problems with erections and ejaculation. Now those risks are gone, which obviously a lot of men are worried about. The second thing is, it turns out that there probably is a price to waiting. If you delay treatment by using medications 5 to 10 years, it turns out the guys who wait longer never are as happy as the guys who intervene earlier. So now that there's an option available that's quick, easy, paid for by insurance, and has minimal side effects, I think it's going to replace some of the medication market.
All right. And we want a happy guy. Right, Tracy?
We all do.
All right. Steam treatment for benign prostatic hyperplasia, enlargement of the prostate gland. Dr. Toby Kohler, urologist, Mayo Clinic. Thanks so much for telling us about this new treatment.
Thanks for having me.